Well, welcome. Tonight we're going to find a few minutes to talk to another person who is willing to help Milford get better. As I mentioned before, it's kind of tough when we're getting uncontested seats. This is the only contested seat in this year's election. But even more concerning is that we're getting less than 10% turnout for voting. We'll talk about that a little later, but why don't we start with an introduction?
My name is Diana Haynes. I am a retired registered nurse. I maintain my license, however. I have over 35 years of public health experience. I started my career at Milford Hospital and went on to the Milford Visiting Nurses as a visiting nurse and then as a manager. I'm a graduate of Fitchburg State College, where I received a Bachelor of Science degree in nursing, and I also have a certificate in home care management. Both my husband and I have lived in Milford all our lives and gone to all the Milford schools. Last class to graduate from the old Milford High School. Didn't get an opportunity to go into the new high school.
So you were 73?
Class of 73, yes.
So I was the first class to graduate in 74.
You got all the brand new things that they put in. So I have always liked public health. At the visiting nurses, after I worked at the visiting nurses, I went back to the hospital as a case manager, worked for the physicians group as a case manager, and then back to the hospital again as a nurse case manager on the floors and the emergency room.
Let's start with the question I always start and end with. I'm from Milford. Why should I vote for you?
I would say because I have a tremendous amount of knowledge and experience in public health. When I worked with the visiting nurses, we had a contract with the Board of Health to provide their nursing services, which included communicable disease investigations, tracking and tracing, working with the Department of Public Health and the Milford Board of Health when there was an issue that cropped up. We did the flu clinics, we did wellness clinics, we did, in 2004, when the demographics in town started to change, there was an outbreak of TB, which we hadn't seen in a very long time. And I worked very closely with the Board of Health and with the tuberculosis control and the State Department of Public Health to get that under control. It was a difficult job in that population was transient in some respects, so that there's a lot that goes into monitoring tuberculosis, and there was a mandate from the state to do direct observed therapy. In other words, we had to go into the homes and visually see that the patients
We're
or
taking
the
the
residents,
medicine.
right, took their medicines. So sometimes it was a little bit difficult to track down people because a lot of the people there, a priority was work. They were working to make money to live and to send home to other family members. So, and pay off whatever debts they had. So sometimes, as it's going to come, it's going to be later. They were working until it got dark. And the spread of TB is when you spend a specific amount of time in close contact with the people who have TB. After you're on the medications for a period of time, you can go out and you can be amongst other people. But in the beginning, there were a lot of people living in the homes together. They were working together. They were traveling together. So it took a good amount of us to the evening staff, myself, our interpreters, to get the people to understand the need to reduce the spread. And there were little children involved, and we would have to test all contacts. And then, so therefore, you had to hunt up all the contacts. So I worked really closely with the Board of Health at that time. My experience has shown me that it's important to meet people where they're at and try and follow the regulations, or I should say we have to follow the regulations. It's not trying. We have to find a way to follow the regulations, but understand the different cultures that are out there and get them to understand the importance of preventing spread of communicable diseases. So we worked very hard on that. We're educated about the cultures that were coming into town and some of their beliefs and some of their reasons for wanting to live in the town. So it was an enlightening experience. All my life, or all my career at the visiting nurses, I worked with all different cultures that we already had in town. Traditionally, we had a lot of Italians, and Portuguese people and Irish people, and we went into the homes, and you learned how they felt about wellness and illness and treatment of diseases. The importance of tracking and tracing communicable diseases is to identify the source. So say there's a salmonella outbreak. You want to go into the home, ask the questions, and track and trace back to where that might have originated, whether it was in the home, in their own environment, whether it was out of town, out of state, in a local restaurant, which then can cause a huge problem. So we worked very closely with the Department of Public Health and Milford Board of Health. The Department of Public Health sets the regulations. They make the regulations for the state. It's then up to the boards of health to enforce these regulations and come up with ways beyond what the state's recommendations are. So their regulations are the minimum standard. Then the town can come in and, if need be, become stricter with the regulations. If there's a problem in the town, they can make those regulations stricter by enforcing fines or enforcing written letters to people, or in some cases they need to bring them into the Board of Health themselves and have the members of the board discuss with them, what's the problem here? What's your problem with not complying or not meeting the regulations? And education, I think, is key to getting people to understand what it's all about, what public health is all about, how the regulations not only affect them, but can potentially affect a whole community if it ever got to that point. But the Board of Health and the Department of Health works closely with the residents and with each other to keep that in control, to sort of brainstorm when we have an area of noncompliance and come up with ways that we can get people to comply. And what's really the issue? Why can't you comply with the regulations? Is it lack of knowledge? Is it, in some cases, if it's a multifamily rental home, did the landlord not make you aware? And I think I pride myself on trying to be fair to everyone. I don't align with any one group of people. I think that everyone in the town deserves equal and fair treatment. And when they're not in compliance, everyone deserves equal and fair regulate. I don't want to say fines, but the results of not complying with that. We don't treat we never treated one person better than another and overlooked it with this person as opposed to that person.
Are you surprised at the pushback we got from some of the residents about spending more money on VNA for tuberculosis?
At that time, I had come with my manager, the director, to the board and met with the board members to request more money than we were getting because this was kind of an all of a sudden thing. I wouldn't say I'm surprised because a lot of people don't see, if they're not involved with the problem, they don't see it as their problem. It's just like people have asked me, what do you see as the main problem in town? Well, that's going to depend on who you ask. If you're a senior living on a fixed income and they're spending a lot of money in an area that involves children and education, they forget maybe they educated their kids in town, and now, I mean, I'm not picking on them, but now their taxes are rented, are raised.
I was surprised because when the Board of Health came to the FinCom and said we need more money on an emergency basis to stop the spread of TB, seemed pretty straightforward to me. I mean, but yet we had a number of people coming saying, there you go, spending more money on immigrants and not on our people. And I remember it took me aback because I said, well, first of all, they're Milford people. They're living in Milford. Where they came from, what they have for history is immaterial. But second of all, if you don't stop it, let's be self-centered.
Yes.
It's our kids, our grandkids in the same classrooms.
It's it hadn't been a problem for all the years prior to that. I mean, let's face it, we hadn't had TB in this area. And so people automatically link it to a certain population. And they feel they don't want their tax money to go to one population. And it's a matter of education all around. They need to understand, as you said, what can happen if it isn't brought under control.
Especially TB being airborne, you put an infected child in the middle of 20 others.
And there were children that involved in this group of people.
So, I was really surprised because Milford's always taken care of its own. What you said is profound. The state sets the minimum guidelines for certain activities. But Milford takes care of Milford. And if we have to allocate more resources than the minimum, we do. And I start seeing this whole debate about certain vaccines.
Yes.
And now all of a sudden, when we were kids, who ever heard of measles?
I had the measles when I was a kid. I had the chicken pox. I think I had the mumps. I don't think I had rubella. But it didn't seem to be a big deal. Certainly, I think the diseases that are coming out now, they were eradicated with the vaccines.
In the U.S.
Correct.
But now we're bringing in people from different parts of the world where it hasn't been eradicated.
And there also are a lot of different, maybe when I was a kid I wasn't in tune. The TV was, as people say, 3 or 4 channels. You didn't have all the cable channels that you heard about the different states or the different cultures or the different beliefs of people. There's a lot of different, shall we say, religious or exemptions. They have probably what used to be maybe a religious exemption. Now there's many more exemptions to why you don't have to vaccinate
Get
your
vaccinated.
children. Right. And so therefore they're going to be at more risk to...
But how do you feel about that? You have the right not to vaccinate, but do you have the right then to put a non-vaccinated kid in a public classroom and raise the risk for everybody else?
I don't want to get too political.
I don't worry about the politics. I worry about the science.
That's what I believe in, the science and the proven research. And luckily, I see as a plus on the research that I did that Governor Healy has followed the Department of Health and the Academy of Pediatrics recommendations of making available the routine vaccinations, childhood vaccinations. And so, therefore, we have in this, when they go to the pediatrician, they have that availability. And yes, I think the only place you're going to, unless you do a lot of research, and I'm not sure how many young parents, I do have a son, has 4 children, and my daughter-in-law's a nurse. They do a lot of research on vaccines. The only place you're really going to get your information is your primary care pediatrician, and you need to really have a frank discussion with him about your beliefs, but about the science behind vaccinating, and that it's not just about you. It affects many more people than just one person.
What do you see as the mission statement for the Board of Health?
The Board of Health oversees the Board of Health Department. So it's, for the people watching, it's a 3-member board. This is one vacancy that's open. The people that were on the board were there for a very long time, so they were really knowledgeable about all the standards and the regulations. So now, in the past few years, unfortunately, we've had several of the members pass away, and the board positions have been open. So the board oversees the department, who actually is out there following the regulations and doing the day-to-day work and trying to meet the standards. So I see the Department of Health in the town and the board. The board advises the department as a means of protecting the health and safety, maintaining the environment so that the residents themselves are without risk. A lot of people don't understand how the environment and not maintaining certain things in the environment can then impact the residents. So they are there to, I would say, protect, educate, maintain, and oversee the environmental health and public health.
Well, it's going to be a very different board. I mean, we used to joke around when the directors came on the show that Paul Mazzucchelli was the newbie because he had only 30 years on the committee. And you had Lenny and Ken, and I mean, you're talking 40-plus years each. There was a lot of history built in.
And for the most part, that's good. But right now, unfortunately, with their passing, and fortunately, it's opened up to newer people with different experiences and different knowledge and education to bring into the department. And maybe some new ideas as to how to maintain and get people to buy into the regulations. Because basically, they're set, as I said, they're set by the Department of Public Health. There's not a lot of leeway there. In fact, there's no leeway other than to make them stricter. Right. So the town has established some bylaws that they've added in, and added in some more recommendations to make them stricter. Imagine when you go out to a restaurant at night, you don't think about all that really goes in to making sure the food you eat is safe. Exactly. So there are so many regulations that a restaurant owner needs to comply with, so many certificates even prior to opening the restaurant. And then we have a food inspector who goes in, inspects the restaurant, makes sure all the standards are met, the DPH standards as well as the town standards. They have everything in place. And then they either certify or don't certify the opening of the restaurant. But you as a resident or you as a consumer go into that restaurant and you don't think about that. Don't think about.
No, I assume.
I mean, you don't. Well, you may because you know.
No, but I'm saying as a resident of Milford, I assume if I'm going into a restaurant and it's got a certificate on the wall.
Correct.
That somebody has done the background studying.
And they're very strict about that. Very strict about. I've talked to all of the people in the department, and they're very strict about maintaining the regulations. But how many families really look for that certificate when you go into the restaurant? Or really, unless someone gets sick, they don't research the restaurant necessarily for the regulations. Maybe they research for how delicious the food is. But,
No, you're right, because if you think about it, when we had the salmonella problem in a restaurant, you heard about that. But any minor infractions, never, where would you go to even find it?
well, I do think it's public knowledge. The inspections are public knowledge. That it's a risk-based format that they use. They make the initial inspection, certify, again, not certify, give the recommendations or give the areas for improvement. Depending on the areas of improvement, may or may not allow them to even open. Then they have to correct them, and the inspector goes back. The restaurants are inspected at a minimum twice a year. And then depending if there are infractions and what those infractions are, the restaurant or any food, any place that sells food, all these little convenience stores that are set up all up and down Main
You mean
Street,
like all the delis and all of,
everything, the schools, the daycares that serve food, restaurants, anything that serves, I believe, beyond just coffee, anything that has to be prepared, even home kitchens, when people are making, jams and jellies for all these fairs, they have to be inspected. They have to they have standards that they have to meet. So if they find infractions, depending on the infractions, they're given a time frame to improve those or rectify
Address
them,
them.
shall we say, rectify them, right. And then, and our food inspector does a lot of education with them. They don't just come in and say, oh, this isn't right, and now you have to fix it, and she leaves. She provides education to them on ways and resources to improve.
do you have any idea what the biggest source of infractions they run into?
Compliance with regulations. It can be anything from improper storage, cross-contamination. There needs to be separate facilities to wash your hands and to wash the food and the different kinds of foods that they serve. And they have to have certificates for allergies, make sure there's no allergies. And even they look at the personal hygiene of the people preparing the food and serving the food. They now have put in a regulation where there is a food safety inspector or manager, they call it, on site at all times when food is being prepared to oversee the preparation of the food. So it can be anything, improper refrigeration or leaving food out too long. Sometimes it's not even about the food. It could be this specific regulations surrounding cleaning of the tables and cleaning of the entire restaurant and area.
Now, the restaurant has to have a senior person who
That's
is,
the manager, right?
the manager.
And they have to have a certification, correct?
Okay, that doesn't say.
Well, it may not be the manager of the restaurant, but there's a person that has to be certified.
For the food service.
Manager to make sure there's proper protection.
Now, they have to be there the whole time?
Mm-hmm.
So
It's
if,
my understanding, yes, from
well, that
what
would
I've
make
read.
sense.
From what I've read, in the entire time they're serving food.
So they have to have a trained supervisor or kitchen manager who's there when they're serving food.
Right. It even comes down to there's a serve safe certification where the servers who bring you your food, there's a certain way they have to. You don't want their hands all over your plate, or they don't want pick your cup up by the top of the cup where you're going to be drinking. So there are serve safe courses. There's a lot of certifications out there that you need to follow. And they're all on the Department of Public Health website. There's an entire manual for boards of health put out by the Department of Public Health with what their responsibilities are.
Now, are those available in different languages? Because I would dare say that a lot of the people working in the kitchen, English is not their first language.
Um, I can't answer that question. I am assuming that the Department of Health has a lot in different languages, and I know that our department has, our Board of Health department has things in different languages. You also have to take into consideration, do the people read? Do they write? Do they understand the terminology? So essentially, it falls on the owner of the restaurant and who they hire and their ability to find. They may have to hire a consultant to train the people or teach the people what the regulations are. That's the same way with housing, following housing regulations, sanitation regulations, trash regulations, which is a hot topic.
You bring up housing regulations. Milford was a leader in setting the standard to eliminate overcrowding. And I know a lot of the people on the Board of Health, like Paul Mazzucchelli, I mean, I laughed when they told me he was anti-immigrant. And I said, do you know his family? Do you know all of our families? We're all immigrants.
In some way, right. We don't know how many generations they go back, but right.
But unless you were part of the indigenous population, and they didn't do too well.
I think that term immigrant, migrant, legal, illegal is often interchanged and shouldn't be necessarily.
I agree with you, because if you think about it, we're all immigrants if you go back enough generations.
Correct.
But, you know, that whole inspection process, do you remember what it was all about?
I want to think, if I remember correctly, it might have started around 2004 when people, it was kind of tied to the TB, and you can correct me if I'm wrong. You've been in this business a lot longer, but people were, I went into a lot of homes at that time. People were putting up curtains, and this may have been going on for a very long time. But now they were putting up curtains to make an extra bedroom for somebody. People were coming from other country, their country. They've heard so and so has an apartment. They rent that apartment to somebody. Then all of a sudden, family, friends are coming in, and where are they going to live? Well, perhaps their residence in their country this might look wonderful to them. So they make makeshift apartments or rooms for the people that come. And I think initially the town was taxing, or not taxing, there was a fee.
Yeah.
There was a fee for every apartment
Well,
you
the
rented.
biggest thing that I remember was there was being put in place for safety.
Correct.
Because when you look at an average house, and some of the new homes are pretty big, but the Luby Ave homes, the Heights homes, Highland Street, Ridgewood, if they still call it, I don't think they call it Ridgewood anymore. But you had 100, maybe 200 amps of power coming into the house, because it was based on one kitchen and a bunch of rooms. When people started splitting it up and putting hot plates and putting 2 or 3 kitchens, all of a sudden you're drawing heavy on the electric.
Yeah, it's increasing your electric, your water, your trash, your spread of illness. If it's not properly cared for, it's a area where you may get rodents coming in if you don't properly dispose of your trash. And there are financial reasons that people did it too, I believe, that the homeowner, well, I can get, I have extra bedrooms, I can rent a bedroom, just put a lock, there's there's one bathroom, so they put in, I know that the town has Article 37, it's a bylaw, where the property owner needs to come in and register their property whenever they're going to rent. And then a safety inspector goes out and looks at the property to see how many residents it can accommodate, and then permits or not permits the homeowner from renting, is my understanding.
Well, again, that was based on overcrowding being a safety risk, being a fire hazard, not counting on some of the other things that you bring up to say, if there's excess trash and it overflows, then you get rodent problems.
Exactly. And who picks it up? When we had the bins, the little bins in the street, we have a nice windy day, a lot of things get blown away. Or people don't, when we were just putting out bags, the black bags full of trash, and many people put it out the night before. Well, I have a lot of rabbits in my neighborhood. I don't know about you. But, rats and rodents are looking for food. And they may tear into these bags. So now all of a sudden the trash is all over the street.
Do we still have a rodent problem? Do you know of? I know for a while, when they were tearing apart Draper, the rodents were following the sewer lines and the plumbing lines, and we were getting a lot of rats coming into Milford. I haven't heard it much.
I honestly don't know the answer to that question, but I know that if the houses are not kept up, and if you have more than one apartment in a home, or it's an apartment complex, you get rats in one, it then becomes, or may become, a problem for others. Or if there's cockroaches in one, they get in the walls and they can go into the next apartment, as opposed to a private home. However, if the property isn't kept up in the private home and they throw trash out in the yard, you know, you are going to have a rodent problem. Or I know the town just installed a dumpster policy preventing people from having individual dumpsters in there unless it meets certain criteria. There's criteria that's set and length of time that they can have a dumpster. People didn't want to use the trash. They say they have too much trash to throw in those bins, but those bins are pretty big.
How do you think that's worked out for the town, the bins?
I think I talked to Amanda Wilson, the director of the department. We used to call Paul the Board of Health agent. But she felt it worked well when people use them properly, because the lid needs to be able to be closed and secured, and then it opens at a certain time when the trash is dumped into the
Trash truck.
right, into Harvey's. And just coming here, there are people who overfill. They are not closing the lid. They're mixing trash and recyclables, which can cause a big problem for the town. It's a cost for when Harvey brings it to wherever they bring the trash to be incinerated. And sometimes I wonder if people are actually recycling everything that they needed to recycle in order to, and there's actually recycles with the trash.
I think there's some confusion, because it used to be pretty clear cut that we paid a price for our trash, $50 a ton to Harvey to take it away and incinerate it. And then Harvey would actually pay us for the recycle. And then China put in a policy that said your trash has to be 95%, your recycle has to be 95% clean, or we won't take it, which is almost impossible. You throw one pizza box into a bin and it's
or you don't rinse out your milk containers or your cans. And I believe they check that at the facility.
And now China doesn't want our recycle anymore.
Oh.
So all of a sudden, we're finding that a lot of places incinerate the recycle. But since we didn't have a contract for recycle, we're paying much more per ton. I think it's like $120 a ton versus $80. So I find myself kind of in the middle of a dilemma. I want to do what's right for the environment and put all my recycles in the blue bin. But if they're not going to recycle them, should I do what's right by the town and throw it in the gray bin and cost less money?
Well, I look at it as we all have the responsibility to follow the rules. I'm a rule follower. And if we get that pamphlet every year with what you should talk to my husband. He recycles everything he's supposed to and cleans it, washes it. But it lists what you can recycle and what you can't recycle.
And how to recycle, because I found that I was one of the people who every once in a while would throw a bag of cardboard into the recycle.
Mm-hmm.
Then I found out the polyethylene bags were fouling the recycle machines.
Well, I have to admit, I was in the grocery store and they had, this was several years ago, they had bags that said recycle bags. They were clear. So I thought, well, this is good. I can put my bags in on my recycle. I used to sort them into paper bags in the
Yep.
bins. And then shredding wasn't recyclable. And then, so you really have to read the regulations. We have the transfer station for people to get rid of a lot of things. We use the transfer station, but I know a lot of people don't want to pay the fees. They don't want to pay to get the sticker. So there's, as you say, there's a number of reasons people in the town have a problem with. It just depends what's.
Well, the transfer station, we always had it. It was called Asylum Street. People would drive at night, and the couch would fall off the back of the pick-me-up truck. The refrigerator would fall off. So having the transfer station always strategically made sense to me, because then I wasn't paying the highway department to go pick up all the trash on Asylum
Correct,
Street.
right.
But it seems to me that I think my sticker cost me $20.
Mm-hmm.
I mean, $20 is money, but it's not that much.
To some people, I guess it is. Unfortunately,
But that transfer station seems to be invaluable.
I think it's invaluable in the fact when you have things that you want to get rid of, there's some place to take them, and you can't throw away textiles in the trash. So now they have textile recycling bins.
Well, the biggest thing was my television died. What do I do with the television, especially now that they're getting bigger and bigger?
Mm-hmm.
To me, it was simple. Threw it in the back of the car, drove it to the transfer station, paid my $20, and
Mm-hmm.
I have a clean conscience. But there's other stuff like oil-based paint, different hazardous materials
Well, they have hazardous material waste,
at the transfer station.
but aren't there specific days you can they hold a hazardous waste?
I thought that was done at the transfer station.
That is at
Yeah.
the transfer station.
So, but without the transfer station, what would you do with it?
It would sit in your garage or your basement for a long time, or people would try and throw it in the trash.
They'd throw it in the trash or throw it in their backyard.
Mm-hmm. And you'd have a stack of,
And I think people forget that what they dump in their backyard goes right into the aquifer,
mm-hmm,
and they're drinking the trash that they threw in the backyard.
mm-hmm.
But overall, I mean, I was worried that the bins wouldn't be adequate for Christmas, graduation parties.
Well, they now have you can buy the bags, the extra bags at several of the big grocery stores, several of the smaller areas. And I think it's like 20 or 20 something dollars for a certain number of bags that you can put trash in and put them on top of your trash bin. In that way, they can have a way to get rid of them.
But we do have large enough bins that I've had weeks where I had to hold off some of the recycles because the cardboard boxes filled it up.
Mm-hmm.
But the next week, I wouldn't say every other week I can fill that blue bin up. That would be rare for me.
I think, right. But there are people that are throwing some of the excess trash into the recycle bin, I think, or using the recycle bin as a trash bin, just from observing riding around town.
That's a shame. That's a shame.
Or my husband will walk the dog and then he'll say, it's recycle day, but people don't have their recycle bins out. they just have their trash bins out, so maybe people aren't recycling, you know.
Well, we used to pay some of the seniors to follow the garbage trucks
Oh, really?
and write down, I mean, I'm gone this week, I didn't put out my trash or my recycle. But if it was 3 or 4 weeks in a row of no recycle, they would report it.
I was going to say, I thought that there was a fine if you did, at one time, if you didn't.
There's still technically a
And they
fine.
could tell by the fact you didn't put your recycles out.
The people, some of the seniors earn tax credit. You know, it's a way of reducing your real estate taxes by helping out in different places. If you were consistently not recycling, my understanding is the Board of Health worked with you and tried giving you a letter, giving you a warning,
Right.
and then
There's a letter goes out and you get a warning, and if you're still not in compliance. But one of the things I think they come up against is there are finding the landlords, because it really ends up in the lap of the landlord, not in the lap of the tenants. And if it's a not on-site landlord, you really have to hunt them down sometimes. And say they live, 50 miles away, and you send them the letter, they don't comply. You send them a fee, they have to pay the fee. But if they don't pay the fee, it continues to accrue.
yeah,
And they need to educate their tenants, really.
but that was the point, to say, at the end of the day, you own the house, you're getting the rent. It's up to you to make sure that your tenants are following the rules. If not, get rid of them. And yeah, I can see where it's been exacerbated because of the rents in Milford. When I start seeing apartments go for $2,000 a month
Or more.
or more, I mean, it's amazing when you think about what people used to pay for a condo, if you call it a condo, an apartment in Luby Ave or the Heights. Now those things are $1,300, $1,400, $1,500.
I don't know about the Heights, but I know Luby Ave was a veterans project, and I don't know how the rents were determined.
I'm not sure.
Yeah.
I know a lot of it was assistance.
Mm-hmm.
You know, and God bless those veterans who needed help,
Mm-hmm.
because they put their lives on the line for us.
Right.
Helping them out a little bit is not something that,
And there were a lot of kids up there, a lot of people, so I can imagine all these regulations were not in force or as strict as they are now.
and I think there's a limit, because when you say as strictly enforced, well, when you put 3 people in a single-family home or 3 families in a single-family home, you know you're breaking the rules. You know, it's not like you're overstepping. I mean, I'll admit, in the old days, I'd put out an extra bag when it came Christmas time. We had all the wrapping and all.
Mm-hmm.
This year, the last couple of years, I've had to fill the recycle, wait till next week or 2 weeks, fill it again to get rid of it. But that to me is not criminal intent.
No, and the recycle should not be waste that is going to be a safety concern. If you're not putting out your trash 1 week, and you keeping it an extra week, and it's not properly taken care of, maybe there's a little hole in the bottom of the bucket, then you can have rodents
Well,
start to get into your
And
trash.
there is the difference, because when I say I was holding on to like Christmas time, all the wrapping paper, all the
Right.
boxes, holding that an extra 2 weeks,
It's not going to be as big an issue,
I wouldn't,
maybe.
the smell alone would force me not to hold on to trash for a month.
They do, I know the one concern I heard about, I went to the Board of Health meeting the other day just to observe, and there are a number of people who feel that the bins, they don't need a bin that big, and they are heavy, especially if you fill them or if you put things in them. So there are availability of a smaller bin for people who
Well,
need
especially for
them.
the seniors who are living by themselves.
Right, or disabled people who have to.
So you can go to the Board of Health and say, I don't need that big blue bin, can I have the smaller version?
I don't know that if they keep them here or you would get them at the transfer station.
Well, but you can get them, I think is the point.
Right, yes. You can get them, and I'm not sure how many people really know that.
We're at that point where
Talk long enough.
our 58 minutes are almost up, but I want to end giving you a chance to summarize your position. I'm from Milford. Why should I vote for you?
Again, as I said, I have the education, the knowledge, the experience of working in public health for 35 years. I have also had the experience of working in the community with the residents, having worked with the visiting nurses. I know what people are up against, what the Board of Health is up against, what their responsibilities are, which far exceed the just restaurant inspections or food inspections or home inspections. I have written down because I couldn't memorize them all, but they have a lot of responsibility and they do wonderful work. And I believe as a Board of Health member, I could bring my experience. It would be an asset. I feel confident in this area of having had come up against different scenarios where maybe I could offer suggestions on how to solve some of the problems with the noncompliance.
Well, I tip my hat to you for being one of the few people who doesn't just have an opinion, but is saying, put me in, coach, I can make a change. I wish we could get more people. Like I said, it's disappointing to see an election come about and we're only having 10% of our population
Last
vote.
year, there was only 5% voting. I went back for the past 3 years.
Yeah, but it's been under 10 for 2-3 years in a row.
Oh, yes, yes.
And I mean, some of the elections, when people say, well, my vote doesn't really matter, we had a school committee election that was decided by,
2 votes.
yes,
I remember that.
so.
And I have a little something I wrote down, and if it's okay, it'll take 2 seconds just to read. But this is a quote by John Lewis. The vote is the most powerful, nonviolent tool that we have.
That's profound.
So if we can get people to get out and vote and not have too many blanks. There were a lot of blanks, I noticed too.
Well, as always, I've always promised that I'll never ask you to vote for a specific candidate. That's up to you. But I'll beg you, get out and vote. Let the people know where you stand. Pick the people who feel the same way you do. And to our 6 loyal viewers, may God bless. May tomorrow be a better day than tonight. Good night, all.